Breasts are milk-producing glands in the female body composed of connective and fatty tissues. Sometimes, due to various reasons, breast tissues start growing abnormally, resulting in a tumor or mass formation in the breasts known as breast cancer. Breast cancer causes painful swelling and stiffness in female breasts, which, if left untreated, results in the spread of cancer from the breast to nearby lymph nodes and other body parts. That's why breast cancer must be treated, for which breast cancer surgery is performed. Breast cancer surgery has two types, which include lumpectomy and mastectomy. If tumor growth occurs in a specific region of the breasts, it is removed using a lumpectomy procedure. However, if tumor growth spreads to the entire breast or, in some cases, to lymph nodes in the surrounding breasts, it is removed using a mastectomy procedure. Because complete breast tissue is removed in the case of mastectomy, if the patient wants breast and nipple reconstruction, then a separate surgery is performed for this procedure. Before surgery, the patient's medical history is collected, and a few tests are performed to identify tumor growth. When the tumor is identified, surgery is recommended to the patient. During surgery, patients receive anesthesia to become unconscious, and a small incision is made near the nipple in the upper region of the affected breast, through which tumor tissues are removed through lumpectomy. Sometimes, in the case of lumpectomy, a wire-guided surgery is performed to identify and remove the tumor growth without damaging the normal tissues of the breasts. If tumor growth starts spreading from the breasts to nearby lymph nodes, it is removed through a mastectomy procedure, for which, in addition to breast tissues, lymph nodes in the armpit region are also removed. If the patient wants breast reconstruction surgery, then mostly after the tumor removal, silicone shells or belly fat are used for breast reconstruction. After the surgery, the wound in the breast is closed with sutures. After surgery, patients are transferred to the recovery room and are discharged after a few hours of hospital stay if only tumor removal surgery is performed. However, if breast reconstruction is also performed at the tumor removal surgery, then patients are discharged after 1 to 2 days of hospital stay. If you have any questions relevant to this video or if you want to suggest a topic, you can reach us through our Facebook page. The link is given in the description box of this video.